Having a perfect figure has become the goal of many of the people who choose to have liposuction. This is a medical technique designed to eliminate localized deposits of fat that neither exercise nor diet are able to remove. It can be done on various areas of the body at the same time, or even in combination with other types of cosmetic surgery. In the human body, adipose tissue is the principal location for the accumulation of the neutral fats known as triglycerides. These are formed from hydrocarbon chains and are highly concentrated sources of metabolic energy. Adipose tissue manufactures, stores, and utilizes them as a reserve source of fuel to meet the body's energy needs. Adipose cells increase in number and size up until adolescence. After that, the accumulation of fat generally results in an enlargement of the cells. Thanks to the technique of liposuction, the number of fat cells can be decreased, a result which is usually permanent. Fatty tissue is composed of a surface layer and a deeper, softer layer, separated by a thin layer of connective tissue. In general, it is the deeper layer of fat which responds best to liposuction. The location of fat deposits in men and women is quite different, due in part to differences in the distribution of areas of accumulation, as well as differences in hormonal stimulation. Liposuction can be performed under local, general, or epidural anesthesia. The equipment used in the procedure basically consists of a vacuum pump, a connecting hose, and various cannula. These are hollow probes with a rounded tip and a number of perforations which allow for effective aspiration with minimum trauma to the body. The ideal suction pressure employed is 1 atmosphere. The cannula is introduced through tiny incisions in the surface of the skin, which, depending on the area treated, are in places hidden from view or where they are very inconspicuous. A number of incisions are usually required to allow the area being worked on to be reached from different directions. Introducing the cannula into an incision, the surgeon manipulates it back and forth through the depths of the fat deposit, creating tunnels and suctioning out the fat. This procedure is also carried out from the other incisions, crisscrossing the tunnels in order to give a gentler and more homogeneous contour to the skin's surface. Both deep and superficial liposuction procedures are carried out to produce extensive clearing and thinning of the subcutaneous layer. This causes the skin to tauten, allowing it to mold better to the new contours of the body. When the operation is completed, the patient is fitted with an elastic garment that compresses the treated area. In addition, it is recommended that the area be massaged to stimulate lymphatic drainage.